So Rishiji, how are you feeling today? It's your day 7 or day 8 of surgery, yeah?
Yes, sir.
Feeling good?
Yes, feeling okay.
Okay. Do you remember anything during surgery? Did you have any pain during the surgery? Do you recall any moments during surgery?
No, nothing.
No,
sir.
nothing. So you were totally knocked out during surgery.
Yes.
And after how long after the procedure you were walking?
I think around after 5-6 hours.
5-6 hours.
Yes.
Did you pass the urine yourself? So long as I remember, we did not catheterize you.
Yeah, no catheter, so I passed the urine myself.
Because I have seen, you know, the lesser the number of tubes inserted into the body, lesser is the infection. So we try to avoid the tubes into the urinary system, and especially no tubes were inserted into your nose or mouth.
Right.
That's again, you know, for such a big weight of 236 kilos. Doing this without the tubes, I would say this is only because of Dr. Rutledge and his procedure, which he has blessed us with, and even our patients are blessed with that procedure, because we could complete this in about 20-22 minutes and give you a minimal amount of anesthesia, and that is what gives us this luxury not to have these drains and the catheter. We just inserted one drain on your side just to take care of the blood if at all it comes out, so that we should be able to see. And in case of rare chances of leak, if it happens inside, then we can diagnose the leak from that drain. And that was a small drain here, which we I think took out on day 2 or day 3?
Day 3.
Day 3, yeah. So now you have got a double-edged weapon. Not eating too much, because of the functional restriction which this intestine is giving you, and then not absorbing too much because your food is right away coming down here at the 250 centimeter points. 250 centimeter point. So keep this in mind. Your bypass length is 250 centimeters, which is like a machine gun, and that's how you have lost about more than 20 kilos in the first week. Because in your case, the target is big. We want to lose at least, you know, 2 persons out of you.
Yes.
So 1/3 we need back.
Yes.
But with a long bypass, if I give you more power, then you have more responsibility.
Yes.
That is what you need to remember now. Because this was required, indispensable. We could not do without a 250 centimeter bypass in your case. And as we explained to you before surgery as well, this is going to be a strong weapon which will give you new life, but you have to be careful not to have any deficiencies. And how to handle that? Eventually your weight will stop at some point. That's how we have designed the surgery for you in a customized manner. That would mean that your intestine will still absorb something. It's not that it will not absorb anything. Because you had a long intestine of 600 centimeters, and out of that 250 has been bypassed and 350 is still left behind. So which is a good length of intestine to absorb any nutrients. Still you will be pushing out a lot of oil and fat in the stool if you take a lot of oil in the diet. You can literally see that oil coming out next day. But our worry is, once you lose good amount of weight, your hemoglobin should not come down from 12 to 8. Your calcium, vitamin B12, everything can come down. But we want low weight but energy, health. So how is it possible? You need to take a balanced diet, nutritious diet, which should be high in proteins. So best would be to have some basic knowledge. What are the foods which will give you more proteins? Like out of the vegetable options, you can take lentil, black, or anything belonging to this group, pulses. it has full of proteins like soybean.
Right.
So try to have more of pulses, and then milk. It's a very good source of protein. Try to have about 2 liters of either whole milk, or better would be to have zero fat milk. You're eating into the intestine,
Right.
and your intestine cannot handle certain foods
Right.
like whole milk. It has got a lot of fat, and maybe your intestine starts giving you a bad time after taking certain things.
Right.
You might feel restless, sweating, fast heartbeat. That's called as dumping.
Dumping syndrome.
After about dumping syndrome, after about some patients can have it within 15-20 minutes, and some would have late dumping like after 1 hour. But if any time you feel like that, sweating and restlessness, fast heartbeat, that means it's dumping. Then you need to see what you had eaten like 1 hour back.
Yes.
So better to maintain a food diary for the first 2 months. Then you will get to know what are the foods which your intestine likes, and you will wonder, it will take you towards Mediterranean kind of diet.
Right.
All the raw vegetables, fruits, your intestine will love. And if you put a lot of oils in the vegetables,
They
it
will
will not
not
like
like
it.
it. Yeah.
And even that oil will be pushed out next day,
Right.
and a lot of gas will pass out, which will be foul smelling.
Right.
That will be embarrassing for you. So then if you look back what you had taken last night, so you'll come to know, oh yes, I don't like this. So gradually you will develop some kind of hatred towards those foods. So that is what I love the most about MGB. And even if, in 1 out of 100 patients, if it happens like you lose too much and you cannot handle your nutrition, we can put the things back. It's easy to reverse. It's easy to revise. 3-4 patients out of 100 might come back with a weight regain after 7-8 years of surgery. Then we can increase the length of the bypass. But generally I have seen it's not good to go in again and again.
Right.
Mini Gastric Bypass gives you the power to be the master of your weight. That's what you need to register in your mind.
Yeah.
It's not like a lock. It's not like 100% solution to obesity, but it is 90%, maybe 95% solution. And like a good luxury vehicle, easy to drive, but don't drive it at 200 miles per hour.
Yes.
Right? So you need to have your control. Less of cold drinks, less of carbs, less of sugars, exercise, proteins, and keep getting your blood work done every 3 months for the first 2 years.
Right.
Because of the long bypass, and then you can have it like 6 months for next 2 years, and then once a year.
Right.
So we'll keep in touch certainly. At least every month you should be reporting us how you're feeling, how much you have lost, and we'll have to monitor your nutrition as well.
Right.
Sometimes it so happens that the patient is not taking good amount of protein, but you'll not feel anything, and for good 1 year it keeps on going like that only. You're feeling good because you're looking good. When you look into the mirror every day, you feel good. But if you are running into deficit every day, say like you required 150 grams of protein and you are in a deficit of 50 grams, you are taking 100 grams every day. So that would mean 50 gram deficit every day.
Right.
Then multiply it with 365 days.
Right.
Then to cover up that much of deficit in 2-3 months will be difficult.
Yes.
So better don't run into deficit. So every day you should be careful what you are eating, and 150 grams of protein, you can even take extra protein powder.
Right.
The protein isolate.
Right.
You can just search on the internet or get it from anywhere.
Right.
You can get good protein isolate products are good for you.
Right.
After gastric bypass, like you are already taking semi-solids from day 2-3, and now from tomorrow you can start with the solids.
Right.
You can take roasted chicken, roasted fish.
Right.
Try to avoid oils,
Yeah,
but
totally.
still once in a fortnight, if you want to have butter chicken, you can relish it, no problem.
Right.
But on the cost that you will be pushing out a lot of oil next day and a lot of foul smelling gas next day. With MGB, you don't have to follow strict guidelines of diet. You have to take this and not to take. You can eat anything and everything, whatever is being cooked at home. And even if you're going out in restaurant, you can try. Generally, avoid the carbs
Yeah.
and sugars.